in this area nowadays. So fundus photography is a non-invasive procedure that uses retinal cameras to capture images of the retina, optic disc, and the macula. Right side, you can see image of the retina. So it can detect and monitor disease such as diabetic retinopathy, glaucoma, neoplasm of the retina, and the age-related macular degeneration, and plays a vital role in identify cause of the preventable blindness. Right. So for diabetic people, it's their retina disintegrates very firmly, and it's very important to know at which stage is there. And for a doctor to take image again and again to analyze, it's very difficult and time-taking job. Now with this kind of system, one can easily, like a system can capture the image, and a trained model can easily predict at which stage like patient is there. So he or she needs attention or not. So easily after that, machine learning for analyzing the result of fundus photography can help in better diagnostic of such diseases. Then in the pathology, so this is also the field, and now in India, many people are using like the telemicroscopy. So what happens? So you just put a slide, you make a slide of some sample of the blood, and from the remote location, so any expert can visualize the disease, whether if there is some some kind of attention needed for the patient or not, or to detect the cancer. So what expert has done, they have made a protocol, or like they have give like set of procedures which is trained by this AI, like the AI people, and they captures like the slide, they take the images of the slides and automatically predicts. So if there is like in the right image, you can see the labeled images. So if there is a presence of this, they can tell, okay, there is a first stage cancer, second stage cancer is there. So histopathological assessment is the gold standard for the diagnosis of many cancer types. The procedure involves processing a biopsy or surgical specimen into tissue slide and staining the slides with the pigment, and then expert pathologist interpreting the slides under a microscope on the basis of visual evaluation. So right side image is the image of the microscope. So expert sees this image and then finally he concludes something. So sometimes maybe because it's very miniature, right? So it's very need very expertise job to identify these kind of things. So some quantitative histopathology images features that are barely noticeable by the human eye and can predict the survival outcomes of the cancer patient, indicating the existence of rich yet previously underutilized information in the pathology slide. So you can imagine a system which continuously take these images, because once you give like a computer or a processor this image, it has the ability to scan all the images, right? So it depends upon your program or the algorithm to see all the, it's not dependent on the human, right? Or the capability of the human eye. So it depends on the algorithm to scan those images and see if there is some changes or attention required. So using AI and machine learning to analyze the visual evaluation maybe give better result in identification of cancer marks and supporting in providing the better diagnosis. And again, these images once you captured, and so this is a pre-stage, a machine can tell, okay, so now the attention is needed. Then an expert can verify whether yes, it is required or not. So again, we have seen in the previous also, so we can see the clinical outcome predictions. So by analyzing stack of data through machine learning, AI can predict mortality, readmission, and the length of hospital stay by using EHR from the emergency department, right? So this is very important, like for again the developing countries, to very precisely use the hospital facilities or the bed facilities for the patients. Now you can imagine this COVID situation. Now imagine a hospital which has, like the patient which has a band kind of thing, and there is continuously transmission of their oxygen, like SpO2, and the pulse rate to a system, right? And that system is able to see there is a change in the, because in the COVID, what happens? There is a certain decrease in the SpO2 level, right? For an individual, it's very difficult to notice that change. Now you can imagine like a system or a setup in which a device regularly monitors that, and it can send the data to the hospital or a specialist, that okay, now there is a change, because it's very easily, right, to quote, if there is a change, sudden change, so there will be alarm, and then like a hospital can contact that person, and then a medication can be given to that patient. So this is the part of where like the embedded system and AI can work together to give a very good support to the medical, like the healthcare system. So data from the health insurance claims can be used to predict mortality in elderly patients. Again, this is all the case studies, right, to help to improve this healthcare system. So patient attributes in the medical notes can be employed to classify a cancer patient with different responses to the chemotherapy. Clinical predictors for the prognosis of the patient receiving thoracic organ transplantation can be identified. So these clinical predictive outcomes could be used to help guide patients and their physicians in choosing an individualized treatment strategy. Again, it's all the same. So you can imagine a cloud. You can imagine a healthcare system where there is a cloud for the take all the data from the patient, and then there is a system which can alarm if there is some like changes which needs attention. So similarly, like the patient monitoring system, which I was talking like in the previous. So this system is used by many hospitals like nowadays to see now what doctor wants. They want like a very like iPad kind of things to see all the health, the vital parameters remotely from the patient. So they very much need this kind of instrument, and now many companies in India also are there to provide such system. Many startups are there during now COVID, they have given. So patient monitoring is crucial in intensive care units, operating room, emergency rooms, and cardiac wards, where timeline is in clinical decision making can be measured in seconds, right? So due to now the COVID, no one wants to be in contact with the patient. So a doctor wants some system, so where he can sit somewhere else and he can monitor all the vital parameters remotely. So routine monitoring devices in these high acuity contexts generate a large amount of data, and thus represent a great opportunity for AI assisted alert system, right? So you can imagine such systems. So by using the vital signs and modified early warning score, a prediction model for cardiac arrest or the stroke can be established. Again, these systems are used now in India. So what a halter kind of devices they take all the data, and this data can be transmit or can be accessible to the surgeon to see like 24 hours, 72 hours data to predict if there is some heart disease or not. So demographics, lab result, and vital signs can also be used to predict cardiac arrest, transfer into the intensive care unit, or death. So now many people are talking about the wearable devices, and I guess you have heard the news of the Apple. They have launched now a watch with SpO2 measurement. Like, right, during this COVID, the pulse oximeter is like the crucial medical device which everyone wants to have, to know the SpO2, because doctor also they see so this is one of the indicator to detect if there is a COVID or not. So modern wearable devices record a plethora of biomedical signals, including heart rate, voice, tremor, and limb movement. So these data can be used, for diagnosing the different diseases. Like if someone has some heart disease, right? So they take the data. The watch continuously records the heart rate and other data, and after that it can be easily see if there is a need of attention or not. So these biological signals could be useful for detecting disease and interfering health conditions. So by the way of illustration, sign of infectious disease and inflammatory responses can be detected early by using heart rate and skin temperature data recorded by wearables. again, now you see, so these kind of devices are very much required to make a database also. Like you can imagine a database for example, if there is a patient A. So now if you have all these vital parameters of this patient A, then for a doctor to see these data and to know, right? Because when nowadays when we visit to the doctor, we used to tell verbally and we may miss some important points. But you can imagine the situation where he can have the access of all the data of last 24 hours. So it's very easy for him to diagnose very accurately and precisely for other things. So the inclusion of photoplethysmograph sensors in wearable enables the monitoring of cardiovascular disease, again, pulmonary diseases, anemia, and sleep apnea. So sometimes the people have, uh,
Okay, sir. I think most of the participants are asking for the slides and the contact information if they can further reach out to you in case of any
yeah.
advice or any further work.
So I can see some queries are there. People are writing.
One of the queries is how do you handle catheter? Sir Vijay Kumar Raut, sir. So he's
Yeah.
asking.
Yeah, so I can see. So nowadays, what the doctor do, they manually put this catheter inside the body of the patient. So they know the force with the hand, to how much they should put, and the live images of X-ray with the help of that, they can manipulate this catheter very easily. So this is so here the drawback is what? Again, when the surgeon is there standing in front of the patient, there is a X-ray. So the surgeon is exposed to that X-ray, and they never want to expose to such X-rays. It's very harmful for them also. So they want to sit somewhere else, and they want to teleoperately manipulate this catheter. That's why they have given us this task, like the problem statement. They don't want to expose to that X-ray. So they want this kind of system.
So one more question is, can cardiac surgery be done by robotic?
Yes, of course. So there is one company which I shown. Corpath is there, and there is some hospital in Gujarat. So they are using that Corpath. So now I can see one more question: how much percentage utilization of robotic surgery in India? So this Da Vinci surgical system you can see anywhere, like in AIMS, Fortis, and many private hospitals are there. They have this kind of system. So many hospitals now they are using.
And do we have any kind of research on nano robot in CSI or CSIO?
So people they are not working in nano robots, but they are working in the nano field. But still, we don't have any project on the nano robotics.
So one of the questions we received earlier also. So what is the safest way to operate in COVID pandemic? Open surgery or laparoscopy or robotic surgery?
Of course, you can imagine no doctor wants to be in contact with the patient, right? So robotic surgery is always the key for that. And that's why nowadays government is also, they're putting they are giving a fund and everything to make everything like teleoperated surgery and for the teleoperated surgery and all. And Professor Saul discussed about the cyber physical system. So this time government has put like 4,000 crores for that. So AI and robotics that comes into that.
Yes, sir. So one question is, which one is better from laser light or robotic surgery?
Between, okay, the laser light, and it's a different, like, so the laser surgeries are different. It's especially for the eyes and all. So that is a different kind of surgery, and here in robotic surgery we are talking about the general surgeries like the gallbladder or standard procedures which you can't do with the laser, you know.
Percentage accuracy of robotic surgery, sir?
So it's like more than 95 or 97%. There are few papers for the Vinci also system. It's quite accurate because there is a standard protocol which any surgical system has to follow, right? So if you have a big manipulation, so this kind of surgical system has a facility to know like the tremors which I had talked about, and then like the sudden motions. So machine will come to stop automatically. So it's quite safe, and there is a safer workspace around these kind of surgical systems.
Yes, sir. I think you have covered most of the questions, and we will share your contact details with the participants as well, if in case they are willing to know further about
Yeah,
any
sure,
kind
sure.
of biomedical applications. And once again, thank you very much, Dr. Ranjan Jha, for your
Yeah,
valuable time, and
yeah, thank
you
you.
a lot of details in precision tools, automation of surgical processes, cardiac catheterizations, robotic system assembly, family 1 in 4 prediction activities which are going on in CSIR and CSIO Chandigarh.
Yeah,
And we wish to be in touch, and further, if any such kind of event happens where the knowledge transfer is possible to the
yes,
community
yes,
of,
sure.
we will be inviting you. Thank you all the participants for your time. I hope this session have influenced all of us to look at the areas to work on in the biomedical and robotics field. And once again, we are just closing for the day. We will again meet you tomorrow for the starting session at around 11 a.m. at 11:30 a.m. And thank you all the distinguished speakers who are also present in this session. I can see Mr. V.K. Raut sir, as well as thank you once again, Dr. Ranjan sir. We'll be in touch.
Yeah,
Stay
yeah,
safe.
sure,
All.
sure. Thank you very much.
Have a nice day, sir.
Okay, thank you.